Hello, it's Bill, the Knee Pain Guru, and welcome to the Ask Dr. Beck show, this week's episode. Welcome, Dr. Beck.
Thank you. Good morning, everyone.
Okay, let's put the link on here where people can go to ask questions. Let me see here. We're going to talk about pain after knee replacement. So the title of today's episode is How long does knee pain last after knee replacement? And the question is from Lisa. I need to have a knee replacement, possibly both, but I am scared. Where the pain and experience? Is the pain and experience that bad like people say? So I will preface this with, if you ask better questions, you get better answers. However, we're gonna play off of the subject and go deeper into this.
The question is open-ended enough that we can explore quite a bit.
Cool.
So the first and obvious answer is that for the most part, people don't make up stories about pain. It's there, it's real for them.
Sure.
So, and we've got to get clear. Our current technology does not allow us to do knee replacements without cutting open the body. And cutting open the body is trauma.
Mm-hmm.
And that trauma very typically, and for most people, results in pain. The level of pain and the duration of that pain depends a lot on the person themselves. Mm-hmm. Some people feel more pain than others. Some people are sensitive to pain longer than others. Mm-hmm. So the way the question is asked, it's almost impossible to give a hard and fast answer. For the most part, we can say it's going to last longer than a day for sure, because you have to heal. And that process can take months to years, depending on what minutia we're talking about healing. For the most part, you can figure, a week's worth of pretty solid pain that you're going to go, oh, did I do the right thing? Did I do the right thing? That pain's going to start to fade after a while. Mm-hmm. Then movement's going to improve. And assuming that you had a conscientious surgeon who lined everything up correctly, your movement post-surgery is going to be significantly better. Now, in my practice, I've had a handful of people who have needed knee replacements. They got to me so late in the process that I couldn't turn it around. We could keep it at bay for a while, but their pain just didn't go away. They got knee replacement, and they're thankful for it. Yes.
Could you talk about the conditions that you were looking at? That I look at knee pain, arthritis, bone on bone. Eventually, you need a knee replacement as a spectrum. So, sure. Is there a delineation? Could you speak on the delineation between, someone is working with a skilled osteopathic person that can help that reverse that, or at least keep that process at bay, and when it's gotten too far?
Okay. We have talked about tensegrity and Wolff's Law before, mm-hmm. but I want to give a small recap, and then that helps to answer the question. Mm-hmm. So tensegrity, term coined by R. Buckminster Fuller, same guy who gave us geodesic domes and buckyballs, the third form of carbon. And it is a combination of the words tensional and integrity. Mm-hmm. And it's a model that allows us to explain how the body works. And basically, the body is self-supporting. We're focusing on the knee. And so when the knee works correctly and the tensegrity system is working as it should, the more load you place on the body going through the knee is what we're talking about, the more the knee joint actually separates in space.
Okay.
So we're led to believe because we don't have a better explanation than the textbooks. That what happens is when we load the body, the bones that make up the knee come closer together. And as we walk, they rub, and that rubbing over time then takes away the cartilage. And that only is correct if the tensegrity system isn't working. If your tensegrity system is working, then your body is self-supporting. And the more you load the knee, the more it separates. Literally, the more space there is for you to move. It's a fascinating phenomenon. Okay, so that is to say that if someone comes in with a complaint of knee pain, we do an X-ray, CT, MRI, whatever it is, and we find degeneration in the joint. By definition, what we have said is tensegrity is not working for you the way that it should. Okay. So then the second thing that happens is something called Wolff's Law. And to keep it simple, Wolff's Law says that the body responds to the forces placed upon it. So movement is the key for us. If we jam a joint, so think, straight finger reaching for a basketball, your hand's off just a little bit, and the basketball jams your finger into your hand. Well, Wolff's Law gets activated. The body still needs to move. And so what we get is something called arthritis. If that happens and it isn't treated, the body will try to reabsorb parts of that joint to get you motion. Now, it's not a great system, but it's what we've got. So if we go back to the knee, which is what we're talking about here, if tensegrity isn't working well, and I've got a joint that now is closer together than it should be, Wolff's Law comes in and says, hey, I'm going to do the best I can to change that joint and get us motion. Okay. The body doesn't have a built-in milling machine where it can go through and say, oh, I need to take off 1/1000th of an inch and everything will be perfect.
Right.
It has cells. It says, I'm going to take away some of these cells. I'm going to add some more over here. That should do the job. And what we wind up with is arthritis. So something that on an X-ray looks pockmarked instead of smooth. More like a piece of sandpaper than a piece of glass. So then, and that's the background, now we've got to look at the forces that come into the knee. And so for most of us, when we look straight down the upper bone of our leg, with the femur, we see a straight leg that it's got a slight angle to it. It's called a Q angle, but it's not huge. For some people, however, primitive reflex has been activated, or they have some kind of trauma that physically keeps their foot from adapting to the ground well. And then when the foot doesn't adapt to the ground well, you get, I'll say, weird forces that come up through the knee. There's more force on the inside or the outside, more force on the front or the back. And it isn't something that's a day-long thing. It's there until it gets treated. Wolff's Law then kicks back in. So let's just say, for example, when you stand up, the force on your leg goes to the outside of your knee. Okay. So if that outside of the leg is then being pushed outward, okay, so we're going to say bow-legged, that's the concept in your mind. Really what that's doing at the knee joint is creating more space on the outside and less space on the inside. That's what has to happen to get you bow-legged. Well, the body then responds to that. It says, hey, I'm going to start taking away cartilage on the inside of the knee so that I got more space to move. And eventually we wind up being bone on bone. And it isn't technically a knee problem. It shows up in the knee, but it started somewhere else. So in the foot or a reflex. And then when you go to the doctor, doctors are trained, and every doctor is trained differently depending on their specialty. So an orthopedist is going to look at it and say, you got a knee problem. And if I put in a metal knee, the metal is stronger. It can combat the responses that are coming in from a reflex or a trauma. And so they think they got the problem sorted out. We didn't get to the root of the problem, but we got you a pretty decent Band-Aid. And so those are the things that go into needing someone to look at your knee. And if we can find what's causing the forces to not be normal and remove that, And if we can remove it while the body can still change in a meaningful way, then great. We have a treatment that over time should get you closer or even back to normal. If it's gone on long enough and what we do is a Band-Aid, it just keeps being a Band-Aid, then eventually you're probably going to need a surgical intervention.
I got it.
Good.
As long as we can reestablish the tensegrity structure in some capacity to allow the body to begin to heal itself.
Yes, absolutely.
Then the potential for not having a knee replacement still exists.
Yes. And if the bone has changed and the change is significant, it's always going to be there. So with my patients, we take a bunion, for example, and I'm going to tell them, hey, if the bunion hurts you, I can work with you and very likely we can get the pain to go away. If you want a cosmetically straight foot, you're going to need to see a surgeon. But that doesn't guarantee that the pain's going to go away. It just guarantees that your foot's going to be straight.
Right.
So this is a little bit of talking to, a fair number of health practitioners, finding out what their strengths are, and putting together a team that through those strengths of the different individuals, you get the result you want.
I have a couple of questions.
Okay.
And potential contributions. We'll see. So, in the understanding of a diagnosis of arthritis, and in what you were saying regarding Wolff's Law, when the tensegrity structure is compromised, the body will adjust to the pressure that it's on there. So it's moving things around in a way to make the joint still movable.
Correct.
How does the diagnosis of dehydrated joint play into arthritis being a dehydrated joint, play into the understanding of Wolff's Law?
Dehydrated joint. So let's just get really clear. Are we talking the night after consuming a fair amount of alcohol, or are we talking about pressure on a joint which pushes fluid out?
The second.
Okay.
And the reason being is in a previous life when I was married to a doctor, I had in-depth conversations around the concept of arthritis, and all diagnosis of arthritis, there is a dehydrated joint in there.
Correct.
Okay.
Correct. So I'm going to say that we need to get very specific about our terminology.
Cool.
So we're going to take you as an example. At dinner, I am going to give you very yummy, non-alcoholic, so it's not going to dry you out. Very yummy beverage, and I'm going to give you a half gallon of that beverage.
Okay.
You're going to consume it at dinner, and whatever it is, fruit juice, doesn't matter. I mean, something, right? We're not going to spike your blood sugar, but the reality is I'm going to put fluid into you in a way that your body can accept the fluid.
Yes.
Okay. As you sleep, what happens is all of the joints in your body, I'm going to specifically talk about the spine vertebra.
Okay.
They get rehydrated while you sleep. Okay. And like a sponge, when a sponge is dehydrated, when it's dried out, you put it in water, it expands. Okay.
Yes.
So same thing happens with your intervertebral discs, so that theoretically, when you wake up in the morning and stand up for the first time, you are at your maximum height for the day. Okay. As you go through the day and move, you're basically squishing the sponge. So that near the end of the day, you might be a half an inch shorter than you were when you began.
Right.
And that's literally just because fluid has moved. But this is fluid in a working system. It's designed to do that. We go to sleep, it fills back up. We wake up, we go through the day, we empty a little fluid. We go back to sleep, it fills back up, right? So it's a cycle. When it comes to a joint that has been jammed, What's happened is the tissue surrounding that joint has enough tension on it that it cannot rehydrate or rehydrate well.
Got it.
Okay. The tension, then, we still don't have the technology to see on an image. So an x-ray is going to show the result, but not the cause, in this case, tension.
Mhm.
CT, MRI, ultrasound, all that stuff is not going to show it. It takes human touch, someone who knows what they're looking for, to be able to push, pull, and move that joint in a way that you're able to go, oh, you know what? This doesn't move normally. It is jammed together. And then someone with that skill set would also be able to treat that and remove the tension holding the joint together.
Right.
Okay. Or inject it. Prolotherapy also works for those kind of things.
Mm-hmm.
And when that happens, movement returns to the joint.
Mm-hmm.
The joint fluid improves,
Mm-hmm.
even though the arthritis may still be there.
Okay.
So there are a lot of things in medicine that we make assumption that A goes with B
Mm-hmm.
that are not necessarily true.
Okay.
Arthritis causing pain, for example, those two don't go together often.
Mm-hmm.
Arthritis in a jammed joint that the joint hasn't been treated is very likely to cause pain.
Mm-hmm.
I can take someone with a definitive diagnosis of arthritis and in typically one session in my office, get the pain to subside. We haven't changed the arthritis.
Mm-hmm.
We've just got movement around the arthritic joint. So it's not painful anymore.
Mm-hmm. Got it. Okay. Thank you. That was good.
Sure.
I've had my own experience with the tensegrity structure with loading the body with more weight.
Yes.
And playing around a little bit with lifting, specifically like powerlifting exercises, squat, bench press, deadlift, press type movements. And I've been seeing how, as I've been getting stronger, there is this feeling of expansion in meeting the weight.
Yes.
Which has been absolutely fascinating, that it's improving posture as I load the structure more.
Correct.
And I felt that this past week. I was like, oh, look at that. I was kind of collapsing on myself, and oh, that feels much better.
Yes. Yeah. Cool.
So I have felt that personally in regards to the tensegrity structure, what you were talking about with the Art Buckminster Fuller concept, that when you put more weight on a joint, it actually expands.
Yes. Yes.
Which there was a little bit of a disconnect for me. I understood the concept of reestablishing a tensegrity structure. However, I didn't realize that the compression on it with weight actually expanded the tensegrity structure.
Yeah. Tensegrity is a very interesting concept.
Yes.
So basically, if we look at the way that we're taught the body works in anatomy class, is that it works based upon Newtonian physics.
Right.
Okay? So think brick and concrete buildings. If we keep that same principle and we simply look at the heart, every time the heart beats, your head would explode because the blood vessels would expand so much. Literally, if you took we'll make it an expensive fly rod, and you held it out with your hand, no fish on it, just the fly rod, the force coming through your spine would be enough to break it.
Say that again.
Take a fly rod. So we're going to say, 2 pounds, right? They're not heavy.
Right.
And you hold it at arm's length, like you were going to cast.
Right.
That torquing force coming through the body of just that small fly rod is enough to break the spine if we're looking at Newtonian physics. And
Okay.
there's a litany of things, like giraffes couldn't exist. Dinosaurs, no way. They're too big. Literally, the weight of them would crush everything in them.
Based on Newtonian physics.
Based on Newtonian physics. Absolutely. Yeah. Absolutely.
I have another piece I listened to, and I'm going to put it in the show notes. It was a podcast by Joe Rogan,
mm-hmm.
and he interviewed this man named Ben Patrick.
Okay.
And he's known online as the knees over toes guy. And his whole approach is working on intrinsic muscles in the legs to increase stability in the joint and explosive power.
Makes sense.
And he was working on three small muscles. One was the tibialis, which is the muscle just in front of the leg. The other one was the hip flexor, strengthening the hip flexor. And the third was the muscle just behind the knee.
Popliteus?
Could be. I could visualize it and I could feel it, but let me see here. No, it seemed to be here. Let me bring it up as far as the video or image goes. Of course, this wasn't. Let's see. Here we go. Let me share the screen. What is this? Are we sharing the screen? Yeah. Well, it's basically this area right in here.
Okay. Let me, so that our users here, let me look up muscles in the back of the knee real quick. Plantaris. That must be what you're pointing to.
Plantaris. It's this whole tension pattern. He's working with the. I got to check out his stuff more.
Yeah,
but so it was fascinating.
The popliteus and the plantaris are in the back of the knee.
Okay. It was absolutely. Let me stop this sharing. It was absolutely fascinating how he was talking about exactly what you just said regarding the tensegrity structure.
Right.
Overloading the joint, but in a way that is very slow and methodical, that builds strength over time in these intrinsic muscles in the legs.
Right.
Hip flexor, what was the other one? Tibialis and those muscles right in back there. And that was some of the stuff that was happening with the training in Systema. We were overloading the joint in a very slow movement squat. We were breathing, and the muscles in and around the knee got incredibly strong around that. And it was building the tendon, ligament, and fascial strength in there. But he was taking it more from a physical therapy perspective of doing specific exercises that were working with these tiny movements that were making the body or the legs incredibly strong and explosive. Anyhow, I was just absolutely fascinated by his story. So I'll share that in there. I'll send you over the link as well.
Okay.
It's exactly what you were talking about. He's just coming at it from a different perspective, more like a weight training physical therapy angle.
Sure.
So anyhow, I came across that this week and I was like, oh my gosh, that's great stuff.
Cool.
So, okay, that was the question. Was there anything else you wanted to touch in and around the pain after knee replacement? I think I'd like to emphasize the fact that many people go into situations with their knees that what a doctor says is the foregone conclusion.
Correct. Yes.
You're going to need a knee replacement. Okay.
Yes. And go ahead.
No, that was really it.
So then the only other thing that I would add to complete this is we're going to go through and the orthopedic surgeon is going to do what they were trained to do. They're going to replace your knee. The surgery itself is going to traumatize the tissues. Those tissues then need to be, and I'll use the word de-traumatized. Healing is one thing, taking the trauma out of the tissues is a second thing. Sometimes they cross-correlate, sometimes they don't. Mm-hmm. And physical therapists, like any other health professional, you're going to have some that are really good, some that are good despite what they were taught. So they were taught one thing and it doesn't make sense and they do something that actually works. Mm-hmm. You're going to get others who do what they were taught, and they were taught well. And then just like every other profession, you're going to get some that despite what they do, they can't help you as an individual because they don't resonate with you. Mm-hmm. Okay. If you are really in tune with your own body, theoretically, you're going to find the person who's going to help you the most. If you're not in tune, then your experience is your healing takes a really, really long time because your body's not getting what it's asking for.
Right.
And so that's the only drawback to having a medical system that doesn't really focus on individuals getting what they need. Mm-hmm. And so for me in my practice, I've had people come in 6 months post knee surgery. Been seeing a physical therapist since the knee surgery. Knee pain is still there. Mm-hmm. 30 minutes later, we accomplished what 6 months of physical therapy couldn't because we just looked at the body differently. Mm-hmm. I don't even know if we did that much that was different, but we put it in a different order. We put it in with slightly different tensions. And I'm not saying it makes me better or worse, just different. Mm-hmm. But the patient then gets to succeed, and after 6 months, pain goes away. Mm-hmm.
Yep. Well, it's sorely needed in today's world. So, let's do our little promo thing for Comella Foundation. Let's see. Our mission at the Comella Foundation is to relieve pain naturally using osteopathic healing principles. The Comella Foundation is recognized as a nonprofit 501c3 under the Internal Revenue Code. Your contributions are greatly appreciated. Please consider taking a moment and donating to the Comella Foundation to help us continue our important pain-relieving work. Every little bit helps. Yes, those donations are helpful. For those watching the replay, make sure to give the video a thumbs up, like and subscribe to the channel, turn on notifications for future videos, share it with your family, friends, and loved ones. We welcome questions that will help you understand your body better and get you moving forward. Okay, Charlie, thank you so much.
Thanks, brother.
Appreciate you being here. We'll say goodbye for today, and we will see you on next week's episode of the Ask Dr. Beck Show.
Sounds great.